Hello students, this is Dr. Ram. Today we are going to see topic so-called Posterior Prosthodontics. Let us move. See, normally what is PPS? It's the area of soft tissue that is seen along the junction of hot and soft palates. You know, on this area if we have pressure that should be under physiologic level, okay, that can be applied by a denture, complete denture process, which helps in the retention of the maxillary complete denture. That's the actual definition for the posterior palatal area. Now, see, just watch the patient's photo. The animated section that shows the presence of PPS in the max arch. It's a Cupid's bow shape. No, this is due to the projection of posterior nasal spine. We are getting the shape of PPS in our bottom morning step as a Cupid's bow shape. Now, what are other names for posterior palatal area? We can call it as posterior alveolar seal area, post dam, posterior border seal, and posterior peripheral seal. Now, coming to the classification of soft palate by house, we can take soft palate class 1 as, which is having a no seems to be a horizontal position that extends posteriorly with minimal muscular activity. So automatically it provides space for the favorable PPS record, which helps in the retention of maxillary denture at the first class level. So what is class 3 before class 2? It causes the most acute contour in relation to the hot palate. So usually the persons with the high V shape, it means high arch palate, they are having this type of class 3 soft palate. What other things? So this leads to the smaller location for the presence of PPS. So poor retention can be the result. So it is class 2 soft palate. It designates between the class 1 and class 3. That's it. And it also going for better retention since it possesses the characteristics of class 1 soft palate. Now, what are the purpose of PPS? Normally, can be go for compensating for dimension changes that occurs during flasking procedures. Okay, and also what are the main things? It provides the firm contact of the denture base with the soft palate that reduces the tendency to go for gagging reflex, and normally automatically it provides better retention. That's it. Now, so what are the things we can see in the posterior part of the maxillary arch normally apart from posterior palatal seal, that is pterygomaxillary seal. Otherwise, in short form we can call it as PMS. That extends through the, what is pterygomaxillary seal? No, that extends through the pterygomaxillary notch, just containing for 3 to 4 mm anterolaterally, approximately the mucogenic junction. That's the actual location of the PMS. Okay, the pterygomaxillary seal. Apart from PPS, we can expect in the patient's max arch. Now, the main part. What is vibrating line in PPS area? So PPS is possessing both the anterior vibrating line and posterior vibrating line. Now, what is mean by vibrating line? It's an imaginary line that can see the posterior section of the palate. That's called palate. Okay, that can be marking a remarkable division between movable and relative movable tissue of the soft palate. Okay, now how come we can find it out in the patient's mouth? We can, if you ask the patient to say ha, you can say the vibrating line of the patient's mouth, so that you can see at the level of the junction of hot and soft palate. So it's not a line, it's an area. That's very important. So what is AVL? Anterior vibrating line. What is that? It's nothing else. It's located at the junction of the attached tissues overlaying the soft hot palate and the movable tissues of the immediately adjacent soft palate. So that's the thing which possesses the shape so-called the bow shape, right? How come we can record this AVL? Normally we can go for basic Valsalva manual technique. What is that? You can ask the patient to go for forward downwards at an approximately angulation of 45 degree. Then, no, before that you should keep grid stick compound the PPS area of the special tray. Then you should insert the patient's mouth. Then have a ideal pressure. Then ask the patient to go for forward downward position at an approximate angulation of 40 degree. Then you ask the patient to blow through the nostrils. At that time, you should open and close the patient nostrils. So this is one of the technique regarding the AVL record, and you can ask the patient even to say ha with short vigorous burst to record the anterior vertebral line. Now what is posterior vertebral line? It's the imaginary line that represents the demarcation, exact demarcation that between the quarters of palate that has limited function movement and the remaining quarters of palate which shows a marked displaced actions during function movements. That's the exact location of posterior vertebral line. Okay, it can be recorded by asking the patient to ha in short bursts but in unexaggerated fashion. So the posterior line is the most posterior part of the maxillary denture, complete denture. Now, how come we can record the PPS during bottom procedure? Nothing else as convention technique, fluid wax technique, and orbital scapping technique. Now, as I told you, for how to locate the PPS in previous video, I explained in roughly in 2 lines. Nothing else. You can insert T burnisher over the result ridge of the complete patient. Just trace it out at the distal end of the ridge, the automatically T-burnisher will dip into the hammer notch. Then bring that T-burnisher into the other side of the hammer notch. We can have a depressed feature in the patient's oral tissue, the PPS area. Then draw with hematoxin pencil dipped in spirit regarding the posterior part of the PPS. So automatically we have a line in the patient's mouth. Then you can go for PPS record regarding convention technique. So keep green compound over the PPC and the special tray in the patient's maxillary special tray. Then insert the patient's mouth. Ask the patient to go for forward movement and at an angulation of approximately 40 degree. Then you ask the patient to go through nostrils. At that time, you should go for immediate closing and opening of the nostrils. So the tensor valve partner muscle of the patient's software is going for a vibrating action that records the proper PPS in patient special tray boarded with what? Gain stick compound. Okay, having a shape of Cupid's bow shape. Again telling this Cupid's bow shape is due to projection of posterior nasal spine. Short form we can tell as PNS. Understand? So in this picture you can see that. Okay, see the animated picture and see the schematic picture. Clear? So the same points repeated in the slide. So what is fluid wax technique? Nothing else. The same resistor recording PPS. Instead of using green stick compound, we can use certain waxes, so-called examples, Iowa wax, Corota wax, Palatal wax, etc. So instead of using BPS, you can use wax. Automatically, the technique is so-called fluid wax technique, which will record the PPS in the maxillary special tray, got the border molding procedure. Clear? Same things. No? So for removing the excess green compound from the patient's mouth, you can use Bart Barker blade. With that you can cut it off the excess. Okay. Same thing you can use for cutting the excess wax in the fluid wax technique. Okay. Now what is arbitrary scapping of muscle cast? It's nothing else. It's very least accurate technique only. It's just guessing the presence of the patient's PPS in the cast. See various casts of various patients. See the size, width, depth. Seems to be like a line, That's it. Okay. So these type of variations of PPS shape you can expect in the patient's mouth. Okay. Clear? Again telling. The basic shape of PPS is Pupit's bow shape due to projection of posterior nasal spine, and PPS has two vibrating lines, anterior vibrating line and posterior vibrating line. Okay, see the approximate width and depth of PPS. Okay, 2 to 3 mm, 4 to 6 mm, and the side depth almost 0.5 to 1 mm in the cast. Clear? So these are things regarding the PPS posterior palatal area, always called as post dam, posterior valvar seal. What are names for that? One more seal we can expect in the patient's maxillary, so-called what? Pterygomaxillary seal. It extends approximately anterolaterally to the pterygomaxillary notch, okay, towards the mucosal junction, approximately in the direction of anterolateral 3 to 4 mm. Make sure we are having two seals in maxillary indentation from arch. Okay, don't be confused with PMS and PPS. PPS is posterior palatal area and PMS is pterygomaxillary area. PP is the main thing for the eye retention for maxillary complete denture. Okay, guys. So hope you got ideas about the PPS in this uh, video class. Okay, we'll see in the next class. If you like this video, you can subscribe and share it. Okay, guys, you can see in the next video. Thank you very much.